A new report found women in Texas needing prenatal care and postpartum care may find it challenging because the state is so big. So it also found almost 23% of Texas women ages 18 to 44 don't have health insurance. KXAN's Erica Brennis has more now on what that means for mothers in Texas.
Joining me today is Divya Sangam with Lending Trees, who discuss a recent report that found that Texas is the second to last worst state in the country for prenatal and maternal care. As a mom in Texas, this is definitely a tough statistic to learn.
When you look at our stats, Texan doctors score quite well in terms of the quality of care they provide. The issue in Texas is access. The problem in Texas is there is a huge number of women who are of pregnancy age, that is 18 to 44, who don't have insurance coverage. In fact, the uninsured rate in Texas is the highest in the country, and this actually impacts the quality of care they're going to receive.
Is that important to have a primary care, or is it sufficient just to have an OBGYN?
Yeah, you can definitely work only with an OBGYN, but in many cases, women may not even be aware they're pregnant. They just may feel some symptoms that they will go to their primary care doctor to figure out, and then it'll get confirmed either through blood test or urine test or some other thing. But the fact that so many women don't have a primary care provider or an OBGYN is extremely scary.
What do these numbers mean for women when it comes to actual impact on their lives and their health?
So a huge part of why access is an issue in Texas is the size of the state, and also the fact that there are huge swaths of Texas that are rural. In fact, 46.7% of Texas counties are considered maternity deserts, where women have low or no access to quality pregnancy care.
In a big metro like Austin, I think it's easy to forget how big Texas is, and how many people do live in small towns that might not have an OBGYN, right?
Short of the government, a Texas government, making it easier for rural hospitals to be built by providing them more funding, there really isn't much a pregnant woman can do. But I just want to throw in a caveat. If you have insurance, it will definitely be a big boon, because your insurance company can actually help you find providers in your area that you can visit to get care. And this includes non-traditional pregnancy healthcare providers like doulas or nurses, who may not traditionally be considered pregnancy providers like an OBGYN doctor, but they can always help you.